New tonight, an update on the overdose epidemic in Rhode Island. Health officials say the shocking spike in accidental drug overdose deaths from earlier this year has been cut drastically, but it's not all good news.
4 people died of accidental overdoses over Columbus Day weekend alone, and we talked to experts on the front line of the epidemic. They tell us the state's latest numbers on overdose deaths look a lot like those from years past, meaning there's still a lot of work to be done. It's an issue we've been tracking for months. Last winter, 3 recovering addicts shared their overdose stories with Eyewitness News.
All I remember is blacking out.
The nurse found me blue and unresponsive.
I stopped breathing.
I prayed to stop using and for God to take my life.
61 overdose deaths in just the first 2 months of the year prompted the Rhode Island Department of Health to call an emergency news conference. We checked with the most recent stats and found the rate of accidental drug overdose deaths has returned to about average since that deadly spike, meaning 2014 still looks a lot like years past. Here are the latest numbers. In September, 8 people died of accidental drug overdose deaths. Compare that to 11 in September 2013. So far this month, 12 people have died, compared to 17 deaths in October 2013. In total this year, 167 people have died. In 2013, by year's end, 232 people had died of drug overdoses.
In September.
Dr. Jason Hack is an emergency department physician at Rhode Island and Miriam Hospitals.
The numbers would bear out that we're probably seeing between 2 and 3 overdoses a day.
While most of the overdose victims Dr. Hack sees on a daily basis survive, his stories from the front lines of the epidemic aren't easy to hear.
A gentleman who was here approximately 5 times in 10 days. And then the goal becomes figuring out ways that somebody can survive long enough that they finally make the decision to stop using their opioids.
Dr. Hack says that's why every person treated for an overdose at Rhode Island, Miriam, and Newport hospitals are sent home with naloxone, better known as Narcan. The opioid antidote can help reverse overdoses from heroin, methadone, and prescription painkillers. Dr. James McDonald with the Rhode Island Department of Health says this wider use and availability of Narcan may save lives.
Since January of this year, EMTs have used Narcan almost 1,300 times. We know the emergency rooms have used Narcan over 200 times.
Dr. McDonald says the greatest hurdle in eliminating overdose deaths is overcoming the stigma of drug addiction. That's why in April, the health department made overdoses a reportable disease so officials can track the issue as a public health problem.
I hope no one thought this was going to be solved this year. No chronic disease is that simple.
Today, the Department of Justice announced the creation of a national clearinghouse of information for law enforcement about Narcan. Now, the so-called toolkit will help train police officers on the use of the overdose antidote. Rhode Island state troopers began carrying Narcan earlier this year, along with police in Burrillville, Richmond, Hopkinton, state sheriffs, and Capitol Police.